Is this your first time at our care clinic today, or do you have an appointment? It's your first time? Okay, so were you looking to be seen today, or? Yeah, okay, let me see if we have, we actually have some availability right now. We have a few open spots, so I'm gonna go ahead and get you checked in, just so when you get back there to actually see the doctor, you won't be sitting back there for long, okay? All right, no problem. Let me just pull up my software. It takes a while for it to load. Are you feeling okay today? All right, that's good. You're just here for a checkup. Nothing's really bothering you, right? Okay. All right, can I have your name? Okay, and can I have your address? We actually have to keep it down because some of our patients have been complaining of like earaches and stuff like that. So I just want to keep the noise level, you know, below average. I'm sorry, could you tell me your address? I don't know if I asked. Okay, and your date of birth? Oh, that's so nice to hear. I'm a Gemini, so. Can I have your phone number? I only need your phone number for our records. I won't be personally using it. And can I also have your email address? Okay, so we're also going to need a emergency contact. So I don't know if you're married or not, or if you have a brother or sister, one of your parents, just in case one day you come in here and you end up having to leave and you're under some kind of anesthesia, or you just don't feel like driving, we can call and let them know to either come pick you up or just let them know in general what's going on with you. Okay, how do you spell that? Okay, and the last name? Okay, great. What is their relationship to you? Okay, and can I have their phone number? So luckily we only need one contact, which is great. I know sometimes it can be mind-boggling to try to sit up and think of another contact, because oftentimes we feel like we're bothering people with our personal problems, but health is very important, okay? So I'm also going to have to put in your employment information. So do you mind letting me know your employer's name? Okay. Do you have the business phone number or your employer's personal phone number? Great. All right, and can I have that business address? Oh, you're fine, no problem. Just, I can backspace it. What is it? Okay. So that's the end of that. I'm also going to need your insurance information. So do you actually have your insurance card? Because I need to make a copy of that. Thank you so very much. So I'm going to put this in here, and your doctor is going to give it back to you after I make a copy of it. So I'm going to print out this information really quickly, and I'm going to give you this cup of pens and pencils. I need you to pick out a pen. As a matter of fact, I'll do it. Sometimes I tell people, hey, I need you to pick out a pen so you can sign your name on the paper, and they pick out a marker or a pencil. This is my personal writing utensils cup. So sometimes I need markers to mark other documents. Sometimes I need pencils to write down my own personal notes, but people try to take them with them anyway. So I'm going to provide you with this blue pen right here to sign your name, and I have to sign my name as well. So oh, the cap is still on, sorry. These pens are fairly new, so we're the first ones to use them. So you're gonna put your signature right here and then the date right here. So okay, and this is for you to sign. You just do that whenever you get a chance to, okay? All right, great. So while you're doing that, I have a few more questions I'm going to ask you. Usually your doctor would ask, but I am a nurse as well. So I'm going to go ahead and get this information from you, so your doctor will already know what's going on. They'll already have it, okay? Okay, sweetheart, your first question is, how often do you exercise? Okay. No, it's no judgment over here. Just as long as you know you're doing some kind of low impact working out, I don't mind. It seems like that's pretty healthy to me. Do you smoke, drink alcohol, or use any other kind of drugs? Once again, like I said, this is a no judgment zone. And as long as we keep our voices down, I don't think anyone will be worried about what we're talking about. People's hearing is a little messed up, so they have other things to worry about. What is your diet like? Okay, you're drinking plenty of water, right? Okay, are you feeling any abnormal pain or discomfort? Your ears, okay. On a scale of 1 to 10, how bad is your ear bothering you? Okay, that's not bad. So is it like pain? Is it irritation? What does it feel like? Itching? You just have itching in your ear? Okay, I'll be sure to add that into your notes. And also, my last question for you is, how is your sleep? Okay, how many hours are you getting? Okay. Right. So I'm gonna give you a personal suggestion. Sleeping on a satin pillowcase, and make sure you're washing that pillowcase at the minimum once a week. But if you don't feel like washing your pillowcases at least once a week, get multiple satin pillowcases, because people don't realize you spend a lot of time laying down on your pillow, and that could cause irritation to your ear as well. But of course, you're going to go see the doctor, and they will give you the proper recommendation for what to do. So thank you so much for signing this. And like I said, your doctor will give you back your insurance card when your exam is complete. And I will be here to check you out when you are done. So just have a seat over there in the waiting area. And when I call your name back, we're going to bring you back into the exam room. And then you're going to meet your doctor. You'll have your exam. You come back out, check out, and then you can go on with the rest of your day, okay? Oh, no problem. Thank you so much for being a model patient. Yes, you didn't give me any issues at all. So I will see you when you're ready to check out, okay? All right, bye-bye. Hello, how are you feeling? That is so great to hear. My name is Dr. Isis, and I'm going to be conducting your cranial nerve examination today. Are you okay? You look a little nervous. There's absolutely no reason to be nervous at all, okay? I'm going to be very gentle with you. There's no needles involved, no poking. I'm not going to ask you to undress. We're just going to do a very simple exam, okay? Now, the only thing I'm going to ask for consent for is to touch your face. I'm going to probably touch your face and, your ears, maybe your neck, but from your chest down, I shouldn't have to touch you, okay? Great. I'm so glad we could accommodate each other. So, like I said, my name is Dr. Isis. If you have any questions, feel free to ask. Just interrupt me anytime you like, okay? So, do you have any symptoms or anything that I should be privy to? Okay, yeah, it says right here in your chart that you were having some ear irritation. It was itching. All right, I'm gonna be sure that I take a look at that. When did that start for you? When did you notice your ear started itching? A few nights ago, okay. And are they like progressively getting worse? Is it just a itching sensation, or like as the days progress it starts to get itchier and itchier? Okay. All right. And as far as you know, does your family have a history of people having ear problems, ear irritation, itchy ears? Okay. All right. Well, that's honestly all the information that I needed to collect from you. Unless there was something that you felt like I needed to know that you did not let my lovely receptionist know, then we can go ahead and get started, okay? All right, so as far as your cranial nerve, before we get to, here you go, far into your exam, there's your health insurance card back, and yeah, we'll get started. So there are 12 cranial nerves that focus primarily on the 5 senses. So we're gonna start off with smell. So we have the olfactory nerve, and I'm assuming that your smell has no issues at all because you came into the room smelling very good. Whatever scent it is you have on, it smells very delicious. No problem. So to test your smell, what I'm going to do is place a few drops of essential oil on these cotton pads. And I want you to tell me if you can identify the smell of the essential oils, okay? So this is the first one. You only need a few drops. Okay, smell this. All right, what's that smell like to you? You are correct. It is tea tree oil. Okay, let me note that down. All right, and I have one more essential oil that I'm going to have you smell. This is what the bottle looks like, and you shake it up just to ensure that it's really mixed in there. Okay, so now I'm going to put it on this one. Here you go. Oh, you have an amazing sense of smell. You are correct. It is lemongrass. All right, so the last thing I'm gonna have you smell isn't an oil. I'm gonna have you close your eyes, and I'm going to waft this underneath your nose, and I want you to tell me what it smells like. Okay, so close your eyes for me, just like that. What did that smell like to you? That is correct. It is baby powder. Okay, so as far as your olfactory nerve, it seems like that's fine. So I'm going to put that in your nose. All right. The next thing is your oculomotor nerve. That is your eye movement and pupil reflex. We also have your trochlear and your abducens and your optic nerves. So all of that is just your vision and eye movement. So I have a series of tests for you that I'm going to conduct. Okay, and the first thing I'm going to do is take this tool from my personal pencil cup, and what I'm going to do is have you focus on this stick. Okay, if it makes it any easier for you, I want you to focus on the butterflies of this stick. Okay, wherever the butterflies move, that's where I want your eyeballs to move. Okay, I'm going to examine your eyeball, your cornea, your whole pupil. Okay, and I want to make sure there's nothing abnormal going on. So right now, I just need you to focus on this pencil. Okay, just focus on the pencil. Okay, you're doing so well, and so far your eyes look so perfect. You must eat a lot of carrots. Okay, I'm gonna ask you a question. I want you to be honest. Okay, are you a smoker? All right, I'm noticing some redness in your eyes, so I want to ensure that your blood vessels are okay. Like when you move your eye that way, I see a little bit of redness, but it looks like it's going away, and your eyes are not irritated, right? All right. Okay, so your eye movement is pretty strong. I'm not concerned about that. Like I said, I am concerned about that little bit of redness, but it's nothing very concerning. So my next test that I'm going to administer is the finger test. I'm going to take my fingers and I'm going to wiggle one of my fingers. This is your right and this is your left. This is my right and this is my left, okay? Just so we aren't confused. When I wiggle one of my fingers, I want you to tell me which finger it is that I wiggled, okay? So you're either gonna say this. This either means I'm wiggling your right or my left, okay? I'm gonna need for you to add the pronoun, okay? So you're either gonna have to add your left or your right, because sometimes when I say, do you mean the right? People get confused, and we need as much of an accurate read as we can get for your eye exam, okay? All right, so I'm gonna get close again just to really look at your eyes, and I want you to tell me which finger it is that I move on the count of 3, okay? 1, 2, 3. Good. Great. Awesome. Good. 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 You're doing awesome. That's good. Okay. All right, you did so good. I actually tried to throw you off with that last one, but you're too smart. So your reflexes are great. Your eye movement, like I said, is great. Okay, and the last thing I'm going to do is just shine a light in your eye. We are actually out of the flashlights that we use right now, so I'm just going to use my flashlight on the lowest setting, the lowest brightness. So I'm just gonna check in this eye first, and then after that I'll look in this eye, okay? All right, so let me cut on my flashlight, sorry, and make sure the brightness is not very bright. All right, that's good. So I'm gonna look in this eye. Can you look at my finger and follow my finger? Yeah, see, that redness is already gone. Okay, I just wanted to look at it with some light. All right, let me look at this eye now. Follow my finger, okay? Okay, great. So it looks like your eyes are doing pretty well. I'm not really concerned about that, so that's good. The next thing we're going to take a look at is your vestibulocular nerve, and that's for your hearing and balance. So we're going to really look at your ears, and I'm going to get you to balance on one foot, so just go ahead and prepare yourself for that. But first thing we're going to do is take a look at your ears, okay? If that's all right with you. So I'm going to look in your ears with my flashlight first. Yeah, let's see what's going on in there. So can I actually get you to turn your head like just this way a little bit, like this? Yeah, just hold your head like that just for a second, okay? So let me take my flashlight and see what's going on in here. Okay. Have you been scratching your ear right here? I can tell. Let me move this out of my way because I'm gonna have to actually go in here. It's looking like you actually have some stuff in your ear. I'm gonna take this vibrating tool and see if we can use the pulses from this to vibrate it out of your ear. So you might hear and feel a little tingling, but it won't be painful at all, okay? Okay. Now I'm going to take a Q-tip and some cotton pads and just clean out. I'm actually going to take some water and spray it on a Q-tip. Because it's looking like it's just dead skin buildup and that can cause itchiness. When you wash your face and stuff in the shower, don't forget your ears too, okay? That's feeling a little better already, isn't it? Yeah, your ears were a little bit dirty on this side, so I'm going to prescribe you some medicine for inflammation just to see if that'll go down, because I know you constantly causing friction in your ear with your finger. That's what's causing it to swell up, and in turn the dead skin also is what's making it itchy. So just keep an eye on that, okay? And I'd also like to recommend a satin pillowcase for you to sleep with, just so you know, the friction from a cotton pillowcase isn't rubbing up against your ear and causing further irritation. And also, it would be smart to keep a few of those on hand, just so you can, you know, put a few in the washing machine and just have a few that you can alternate throughout the week, because dirty pillowcases is the beginning to a lot of health issues, okay? All right, so I'm going to turn your head and check on your other ear, and then we'll move on to the next thing, okay? All right, I'm gonna take my flashlight and look in your ear. This ear is not as irritated at all. There is a little bit of dead skin buildup, so I am going to spray on this Q-tip as well and just give you a light ear cleaning. That should feel very soothing to your ears. I'm glad. Okay, so the last thing we are going to do as far as your ears is give you a kind of a hearing test, okay? So I have a piece of chewing gum and I'm gonna chew it in both of your ears. I need you to tell me if you can hear it, okay? So just close your eyes and I want you to tell me which ear I'm chewing in. Okay, you can open your eyes now. Do you know which ear I was chewing in? Okay. Close your eyes. Okay, you can open your eyes now. Do you know which ear I was chewing in? Perfect. Okay. The last thing I'm gonna get you to do, I'm gonna tilt your head back to the center, okay? Take out my gum because it's very rude. So the last thing I'm gonna get you to do is balance on one foot. So I need you to go ahead and stand up for me. Oh, you're so tall. Okay. So now I want to see you stand up on that foot. Just, you don't have to do a cheerleader stance. Just slightly lift up that foot for me. Okay. And if you need to hold your arms at your side, you do that, okay? Okay, now do your other foot. Your balance is pretty okay, but whose balance is perfect? If your balance was perfect, you would be in the Olympics right now. All right, so lastly, we are going to check your sensation, your feeling and things like that. Not your feelings like I am a therapist, but your actual physical feeling, okay? So we are going to, let's see. Okay, now we are going to test your trigeminal nerves. That's your face sensation and chewing, and your facial nerves, and your accessory nerves, which is your neck movement. So I'll go ahead and do your accessory nerve, which is your neck movement. I'm just gonna get you to turn your head again. Just turn it that way. Okay, looking at your neck. I can feel your pulse. It feels very strong. Okay, now turn that way. Your pulse feels very healthy. So your accessory nerve is great. Now I'm going to look at your trigeminal nerves. So now what I'm going to do is lightly touch your face, if that is okay with you. And I have this kit right here. It's been sterilized. I have fresh gloves and tools to use on you. So I'm just going to use one of my hands. And I also have this brush that I'm going to be using as well, just so you can feel it sweeping across of your face. So I'm just going to lightly touch some parts of your face. And I'm also going to be swiping your face with this brush just to see how your skin reacts to certain sensations. So how it responds to the sensation of touching, also how it responds to the sensation of light light brushing. Okay, it seems like it's okay to me. So the last thing I'm going to do is check your teeth, because I'm pretty sure the trigeminal nerve has something to do with chewing as well. So let me switch out gloves right now. And also get my tool for checking your teeth. And I'm not a dentist, so I won't be checking all of your teeth. I'm just going to be checking your back teeth, the teeth that you chew with. Okay, so I'm just going to get you to open your mouth for me. Say ah. Let's see. I'm just tapping. The teeth in the back on this side, and they seem pretty hard and healthy to me. All right, now let's do the other side. Let's see. Okay, you can close your mouth. Like I said, I'm not a dentist. I was only going to be checking your back teeth to make sure that, you know, you're able to chew correctly. If you have any kind of oral concerns, definitely consult your dentist, okay? So it looks like we are all done here. You were an amazing patient. You are very healthy. And you're gonna have to tell me what scent that is that you're wearing right now, because you smell darling. Okay, so I gave you back your insurance card. And do you need a doctor's excuse? I'm just doing my end notes. Okay, great. So like I said, you seem very healthy. I have your chart updated, and oh, just to let you know, our receptionist, she stepped out for lunch, so you're gonna be checking out with me. It looks like you used insurance anyway, so you don't owe anything, which is great. So I guess I will walk you out. Yeah, I want to make sure you didn't know anything. Everything seems like it worked out very well for you today. You're in and out, and you can go on about your day. I told you I was going to send you a prescription for inflammation over. We have your preferred pharmacist already in the system, so we'll send that over. But I do want to recommend some vitamin D, just for you to buy over the counter, and just start taking that every day. And I'm pretty sure that'll clear up all the irritation that you got going on with your ears, okay? No problem. I'm going to go ahead and walk you out, and I will see you on your next checkup. Okay, bye-bye.